First of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your faces in the video. As a reminder, please take the online learning evaluation test exercise for mastery of learning and have a certificate score to get a to have a perfect score to get a certificate like this one shown here. That I have placed the link in the chat box. I think the OLETE contains only a few questions this time, less than 30. Okay. Another reminder, please take passers of 50 OLETE certificates will entitle one mentee to a voucher for a ROJoson telemedical consultation. We are now on our 109 pep talk. So anybody who has attended all the 109 or 8 or 9 pep talk has 2 certificates already. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Ready? Everybody set? Okay. All in? Okay. 1, 2, 3. I have a patient empowerment program in which I'd like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course, as seen here, on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. My pep talk today is entitled Fundamentals in Infection, Prevention, and Control. This is in consonance with the DOH Health Awareness Calendar. So August na ngayon, pero pahabol lang. So in July, the 3rd week of July, the DOH declared that we were celebrating the National Infection Control Week. So pahabol na lang ito. Okay. So the empowerment objective will be for the lay people to have an essential understanding of the fundamentals in infection control, prevention, and control in their health management. The contents of this particular pep talk will be the following. What is an infection? What are the different types of infection? What are the causes of infection? How to prevent infections? How to recognize infections? And how to control the infections? As I said, this will cover the fundamentals only of these topics. As a disclaimer, the contents of my pep talk will contain my thoughts, perceptions, opinions, and recommendations, or TPOR, called from my personal experience as well as from other professionals. Let's start with the first topic. What is an infection? The simplest definition is that infection is the invasion and growth, invasion first, then growth of germs in the body, causing symptoms of infection such as fever, pain, redness, and pus. So dapat may kasamang invasion, growth, and then may symptoms. So the presence of germs or their multiplication per se is not infection. Kung walang symptoms, merong germs ka, merong dumadami ang germs doon, but it's not causing symptoms, it's not causing invasion, just andun lang sa katawan mo, we call that colonization. So as I said, there must be invasion and there must be interactions between the germs and the body with clinical expressions through the symptoms such as fever, pain, redness, and pus, and other symptoms. What are the different types of infections? So the types of infections are basically classified as what kind of germs are causing the infection. Ito pinakasimple kung ano yung germs na dumapo that's causing the infection. So basically, the germs may be bacteria, viruses, fungi, and other microorganisms. So ang pinaka-common will be bacterial infection, viral infection, and fungal infections. So these are the three most common types of infections in the human body. What are the causes of infection? As mentioned, there must be invasion and damage of the germs to the body tissue and organs. So the first factor for this one to have infection will be the load of the germs or germ load. Okay. Example, what is the load? Ano yung gaano karami yung bacteria, gaano karami yung virus, no? And then gaano karami yung fungal. So this is, when you say germ load, is the amount of bacteria, virus, and fungi or the germs. Okay. Then the other requirement for the infection to take place is that there must be invasion by the germs to the human body. Okay. And the third factor is susceptibility of the host. Dito nakalagay dito, when the body's immune system is strong, it can often fight the germs and cure an infection. So kung mataas ang host resistance, you may have these two, mataas ang load, may konting invasion, no? Pero kaya ng katawan supuin, then you don't have that clinical infection. So in the invasion and growth of the germs in the human body are the usual causes of infection. Infection can begin anywhere in the body, anywhere, and it may spread all through it. Sa ibang parting katawan, pwedeng pumunta. The infections can begin anywhere, as I said, in the body and may spread all through it. Ang pasok noon, entry points will be, number one, through the skin, sa balat. Number two, through openings in the human body. So try to identify the openings in your human body, Okay. Number one will be the mouth and the nose. So the mouth and the nose will lead to the digestive tract and the respiratory tract. Okay. Then ears is also an opening there that can be an entry point for infection. Then at the other end, sa baba naman, yung puwet, yung anus is another opening that can cause infection, that can lead to infection. So importante itong, just remember itong tatlong openings, mouth and nose, ears and anus. And then the other entry point will be through the bloodstream or lymphatic channels after entry through the skin and openings in the body. Okay. So pumasok na, may invasion na ng skin, may invasion na sa mga openings, and then pupunta sa bloodstream and lymphatic channels. How to prevent infection? So let me re-emphasize the different causes. So The risk factors will be the germ load, invasiveness of the germ, and then the susceptibility of the host. So there must be invasion and growth of the germs to make to enable the infection to take place. And as I said, when the body's immune system is strong, it can often fight the germs and cure an infection. So the first element here is the germ load. Okay, so how to prevent it? So avoid contact as much as possible with the germs, all possible places that can cause colonization and also datapuan kayo ng mga germs. Okay? So avoid as much as possible, zero, totally wala. And then, kung di natin kayang iiwasan, then we try to decrease the load. Okay? So if zero load is not possible. Now, the other factor that can cause infection is the invasiveness of the germs. Mahirap sabihin kung which germs are invasive or not. No? Okay. So we just try to avoid contact as much as possible and then decrease the load if zero load is not possible. The susceptibility of the host is another factor for infection. So the way to prevent infection will be to improve, increase, and maintain host resistance through healthy lifestyle. When you say healthy lifestyle, it involves healthy diet, exercise, proper amount of exercise, and then mental wellness, hindi palaging stress, hindi palaging over-anxious, okay? So as I said, let me emphasize, when the body immune system is very, very strong, it can often fight germs and cure an infection. That's why one way to prevent infection will be to build up your resistance. No? Either by, if it's mahina na, you try to improve it, or kung meron na, pero dumadapo na infection, no? So increase it. Kung maganda na yung host resistance mo, then you try to maintain it. Okay. How to avoid, ito yung mga ways to avoid yung mga germ loads and invasiveness of the germs. Okay. Number one, the most common is still hand hygiene. We have learned a lot of lessons through the COVID pandemic. We saw the importance of hand hygiene. Okay. So we try to decrease or zero the load on the body through the skin and openings. And we also decrease the passing from the hands. Okay, galing sa kamay, kung saan pumupunta, sa balat, sa mata, sa mga different openings. Then the other type of hygiene is body hygiene. And the best still shower, okay, not bath. Okay. So shower, try to wash off all the germs on the body. So again, it can decrease the, and try to make it zero, the load in the body through the skin and opening. And then the other ones, of course, when you talk about decreasing the load, no strategies in decreasing the load or invasive or the germs, the invasiveness of the germ, we try to use facial mask. Okay. So again, we have experienced this with the COVID pandemic. So this will try to decrease the load that will go into the respiratory tract, no? Through the mouth and nose and then to the respiratory tract. Okay. Insurance of vigilance on clean things placed into the opening of the body, ears, nose, mouth, nose, and anus. So we try to be on guard of whatever things that we eat, the food, whatever things, the water that we drink, and also the cleaning of the ear. When we clean the ear, make sure that we're doing it properly. So this is to avoid the infection of the ear. Well, how to recognize infections? The cardinal signs, symptoms, and signs of infections are the following. When you say cardinal, ito yung pinaka-main. These are the alert signs. Okay. Number one is calor. When you say calor, it's a warmth or fever. Number two, dolor, pain, masakit. Number three, rubor, okay, redness, mapula. And then swelling, we just call it tumor, but this is baka misinterpret ninyo as cancer, no? Okay, but when you say the word tumor, okay, what it just means in terms of infection is just swelling. Then functional, Lisa, okay, meaning loss of function kasi masakit yung kamay, masakit yung lugar, kaya hindi nagagalaw. No? So loss of functions. No? Then of course, pus. So kung meron tayo nakitang pus, no? 99.9% we're dealing with infection. Kung wala pang pus, but you have fever, you have pain, you have redness, tumor, and loss of function, you suspect infection already. Okay? Ang number 2 reliable sign will be when you see redness, pag mapula-pula na. No? Pag mapula, after pus, pus siguradong may infection. Then redness is another reliable clue for infection. Okay? Pag walang redness, walang pus, may pain, may fever, may swelling, and loss of functions, although you still suspect infection, pero hindi ganong kabigat when you have redness and pus. Okay. So we have experienced patients, also people who have felt fever lang. Okay, mahirap pa sabihin kung may infection o wala, no? Okay. So okay. Pag after the fever, meron ng redness, meron ng swelling, then that's all the more we are quite certain now that an infection is taking place. So ito yung mga illustrations for the 5 cardinal signs of infection. Okay. Pain, masakit, no? Heat, mainit, no? Warm, may fever, and then redness, and then swelling, okay? And then loss of functions, and then the pus. Nana, okay. Another illustration after injury, okay. So you have redness and then warm, and then you have swelling, and then you have pain, okay. And then you have loss of functions, and then you have pus. Example, we have pus flowing from the base of the nail. So mukhang big toe ito, no? Okay. Infection of the big toe. So how to control infection when they set in already? Pag dumapo na, how to control naman? For infected surface wounds, yung mga nasa ibabaw lang, sa skin, no? Sa bibig, no? Okay. So wash with water and mild soap at least once a day. Okay. So at least once a day, pwedeng twice a day, pwedeng 3 times a day as needed, no? Depending on gaano kadumi, gaano kalala ang infection. For infection that needs medical expertise, of course, we have to consult a physician right away. Okay. But other than those things that needs a doctor expertise, you can a lot of times you can evaluate yourself. Now, kung mild lang, you can do it with self-care. You wash it with soap and water, mild soap at least once a day. Then take proper medications for germ control, but only when needed, as not all the infection will need anti-germ drugs like antibiotics for bacteria, antivirals for virus infection, antifungal for fungal infections. Okay, so not all infection will need antibiotics, antivirus, and antifungal. Okay. Sometimes or a lot of times washing them with washing it with water and soap might be sufficient, and then you just rely on your host resistance. Then as mentioned, ang scenario dito is that infection is already set in, so that's why I use the word reinforce. Okay, so this is on the assumption that you have been doing hand hygiene and body hygiene, and yet infection has set in. So strengthen your strategy, no? Strengthen your habit, yung ginagawa ninyo by reinforcing hand and body hygiene. Then improve the host resistance by taking a good rest, okay? Mental, physical rest, adequate healthy diet, high fluid intake, tubig, maraming tubig, and then still with moderate exercise. Wag lang tulog ng tulog. So kahit na may sakit, may konting exercise as kaya, as able to. No? So I think that's the last slide on the fundamentals. Okay, so I've covered the following topics. What is an infection? What are the different types of infections? What are the causes? How to prevent, how to recognize, and how to control infections. Takeaway in relation to patient empowerment: be always in touch with reliable medical information on fundamentals in infection control, prevention, and control. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, knowledge, kakayanan, karapatan, right, and kapangyarihan. Self-determination: to gain greater control over decisions and make better decisions on infection prevention and control in your health management. So this ends my talk. I hope I have empowered you to have a better understanding of the fundamentals of infection prevention and control in your health management. So before we go to the interactions QA, a reminder, please take the OLETE. Okay. Konti yung mga questions doon, kaya madali. And then, 50 OLETE certificates will entitle one to a voucher for a free ROJoson telemedical consultations. Feedback to this pep talk, please type in your feedback in the chat box during the open forum and before we adjourn. Okay. I just put this provision because not all of you are taking the OLETE, so that I can see your feedback in the chat box. So let's now have a group picture taking before we start the QA and interactions. Okay, everybody on board? 1, 2, 3. Okay. So the floor is now open for questions, comments, recommendations, additions to what I've said based on your experience, or if you have things to consult me, free consultation, as long as short lang. Okay. I suppose all of you at your age, at my age, have experienced infections already before. Tama? Nobody can survive, can live long without any infections. Diba? Once or twice or thrice. I hope once. Okay. So who wants to share their experience with infection? Anybody?
No.
Susan. Susan.
Tama, I just had operation and you already removed these stitches, right? You said just wash it with soap and water, right?
Yeah.
And then just keep it dry.
Yes, what? Keep it dry.
Afterwards, keep it dry. Oo.
Yeah. Yeah.
Paano kung parang may watery substance na kumisang parang ganun?
Kung may watery substance, no, as long as it's not pus, no, it's kasi kung watery substance, when you say watery substance, it's fluid.
Baka pinagpapawisan or something,
Okay, fluid. Basta, I suppose it's coming from the wound, di ba?
Yeah,
okay.
Yeah.
So basta you just determine whether it's pus or not pus. Okay, that's as simple as that. Kung di naman siya pus, so it's not infection. No? So how do you explain that from our medical perspective? No, usually pag may sugat, minsan may mga secretions pa yan dyan, no, mga fluid, no? Okay.
Yeah.
Trying to come out. No, hindi siya a lot of times these fluids are reabsorbed, na-absorb ng katawan, nawawala, no? But there are times
Okay.
which hindi siya na-re-reabsorb, hindi na-absorb at gustong lumabas. Okay? So pabayaan mo lang lumabas. Okay?
Mm,
Okay.
yun,
So
ayun lang yun.
eventually it
Okay.
will disappear. Eventually it will, I mean, it will disappear, it will resolve by itself. No? Ganun. Basta importante hindi siya pass. Okay?
Okay. So no need to put anything or what? No.
No,
Just wipe it off.
yeah, wipe it
off.
off and then just keep on washing it with soap and water, no? And then if it's so soiled, kasi when I say just leave it dry, no, without any dressing, this is on the assumption na tuyo yung sugat mo, di ba? Kung merong
Okay.
kung merong mga fluid or watery discharge, you may have to put a parang tapal or a dressing or a gauze, no? Para hindi lang mabasa yung damit mo, no? Okay? Yun lang, no? Wait until the fluid will disappear, no?
Okay.
Okay?
Pwede another thing, but one last thing. Is it true that
Pwede pang marami kung gusto mo.
is it true that the sign that your wound is healing is that it's itchy? The surface is itchy. Is it true?
Yeah, from our experience, yes. No,
Okay.
I was trying to look for the scientific explanation there. They say that there's a substance there, no, but I cannot remember what substance on a microscopic, on a very molecular level, no. Okay, but from experience, no, I've a lot of patients are telling me Makati, Makati, Makati. No, okay. So Makati is a sign, I think it's acceptable, it's accepted na. It's a sign of healing. No? Okay.
Okay. Thank
Pero
you.
it's not very, well, don't rely on that. No? So for the sign of
What is
healing,
really the sign of healing?
you look at the wound,
Okay.
not yung feeling of itchiness. Additional lang yon, additional clue na lang yon. No? So,
Okay. Thank you.
so if it's itchy, kung may infection, palagi ko, that's a sign of healing, di ba? Pag may infection. Okay. So I don't know kung may infection, kung may kasamang healing, may kasamang itchiness, do you consider the itchiness as a sign of healing? Hindi pa rin, di ba? So, very subjective kasi yung itchiness, di ba? Pero, so the assumption there, kung wala kang clear signs of infection, clear signs of non-healing of the wound, let's say bumuka, no, yung sugat mo, no, so kahit na may itchiness ka, yung itchiness mo will not be a sign of healing, no, okay. You get it? You get what I'm trying to explain? So, ang pinakamagandang basis is the visual appearance of your wound, no, okay. Wag yung subjective feeling. Yeah, when you come for checkup in the hospital, in my clinic, I usually look and palpate your wound, di ba? Okay.
Yeah.
I don't think I have ever asked a patient, Makati ba? I don't think I've done that, no? Okay, I rely on my inspection by looking and then by kung kailangan ipalpate, ipapalpate ko, no? Okay.
Okay.
Okay. Nice question.
Yes, thank you. Thank you.
Okay, any more questions? Jocelyn T. Okay, I bet Jocelyn T.
Yeah. Question is,
Time na. Okay, so there's a note there. Thank you, Doc, for my free face-to-face consult via the free voucher. Okay, I'm keeping my words. Now, if you have obtained 50 letter certificates, you're entitled to at least one voucher. Okay. So Jocelyn T has availed of that. Jeng De Castro has availed of that. Sino pa? Phoebe has availed of that. Sino pa? Chris Nesesha has availed of that. And yung kay yung mga awards ni yung sa ang tawag doon, yung during the Cancer Crusaders Club, di ba? May mga giveaway, no? So Lordly has availed of that. Okay. Sino pa? Okay, so let's go to the question now.
Okay, this is from Jocelyn P. When you operated on my toenail and the debridement of the toe skin, nakadikit yung sterile gauze. You told me to wash with soap and water na eventually matatanggal ang gauze after much sweat. It was finally removed. Is there a new gauze being used nowadays na talagang hindi dumidikit sa wound?
The answer is of course yes, kasi maraming entrepreneur, basically life is di ba? Man try to find ways to make money. Okay. So if they see a need for that, they will create some new gauze that will prevent yung mga problems of nakadikit, no? But you don't have to go out of your way to buy that. I think kung mayroong mga ganon, more expensive yon, di ba? Okay. I don't think you have to go out of your way. Ang gagawin mo na lang is kung eto ba yung okay. Kung tuyong-tuyo na, no? Kung natutuyo na, kahit na you can just leave it open. Okay? Or kung nasa bahay ka, you just leave it open. You don't have to make balot. You don't have to put a gauze. Okay. Yeah, Jocelyn. Unmute.
That time, bagong opera yun eh. So, basa pa yung wound. Pero time na to remove it para linisin. And then, yung gasa nakadikit talaga, sobrang dikit. Nagpanik
Okay.
ako, I called you immediately sa phone.
Yeah, okay.
Oo, and matagal siya bago natanggal
Okay. Pag, ganun yun, okay. Pag, yeah, I would just remember, kasi probably my next lecture will be on operation wound, no? Operation wounds, no? Yeah, I'm just trying to recall what I wrote there, no? Kasi operation wounds can be classified into closed wound, yung talagang saradong-sarado, and then yung iba partially open, no? Yung iba naman completely open, no? Okay. So yung sa iyo, it could be classified under open.
Open, yes.
Kasi debridement ito no? Debridement
Yes,
na
yes.
tinatanggal yung kuko, toenail ito, di ba? Ingrown toenail.
Yes,
Okay.
yes. Eh, sabi niyo may fungal ba? Fungal.
Yeah,
Kaya na-debride.
So, okay. So we cannot close it. Number one, yung sa paa, mahirap isara talaga kasi konti lang yung space, no? But in mga infected wound, we usually leave the wound open para sumisingaw, para lumalabas, no? So para mag-heal ng mas maaga, mas mabilis, no? Kaysa itatakpan mo. Kasi once you close a wound na infected, yung infection na sa loob, no? Okay? Hindi makalabas, so lalo mag-i-infect, no? Okay. On the side note, natatandaan niyo, side note lang ito ha. Yung mga pag may pigsa kayo, 'di ba? You have experience having pigsa, abscess sa katawan, sa balat, no?
Not yet.
Wala. Lahat
Not yet.
tayo, most likely may pigsa na tayo, no? No? So, sa balat, sa hita, sa okay. So, pag yung pigsa, pag hindi pa pumuputok, masakit na masakit. 'Di ba? Pag pumutok na siya, nawawala na yung sakit. Tama? Agree? Disagree?
I cannot relate yet.
Okay. The others.
Yes. Yeah, that's correct.
Okay.
Hindi pa naranasan.
And then, pag lumabas na yung nana, the best way to treat that wound is just to leave it open. So, or at least for me, I don't usually close it. No? Okay. Pag sinarado ko yun, no, the healing will not be good. No? It might cause further infection lang. No? Okay. So going back to your case is that open wound kasi siya, we have to put a dressing kasi galing ka sa hospital, galing ka sa operating room, di ba? So when you go at
Yes.
home, we put the
Mm.
dressing, no? Okay. So I think there are new ang tanong mo kung may mga dressing na may ano hindi siya
Yes.
dikit,
Yung talaga hindi
meron.
dumidikit.
I suppose meron, pero we have to weigh the pros and cons also, no? Yung mga hindi dumidikit, saka dumidikit. Yung mga hindi siya dumidikit, no? Ang advantage nun, hindi mahirap tanggalin, na? Okay? Pero yung mga dumidikit, kung minsan may advantage din doon, pag dumikit, yung mga dumi, nahihila niya, natatanggal, na?
It's
Okay.
very painful.
Yeah. Yeah, yan ang disadvantage, very painful,
Yes.
no? Kaya usually ang ginagawa lang natin will be buhusan ng maraming tubig, no? Buhusan ng maraming tubig until unti-unti matunaw yung dikit, then it will come off, no?
I remember, binabad ko yung toenail ko, ay yung toe ko, sa basin of water.
Yeah.
And I keep changing the water. Pero matagal bago siya nawala sa dikit.
Baka hindi mo ginagalaw ng konti-konti.
Yeah, masakit kasi.
Yeah. Ganun talaga ang buhay. May talagang you cannot escape all some of the pain that you will have. Okay. So, okay lang nawala na. So, okay. So,
Yes.
so lesson there from now on, avoid that toenail infection.
Yes. Number 1 yun. Then
Ah.
number 2, kung magsa-surgery, request sa surgeon, gamitin na yung hindi dumidikit na gasa.
Yeah. 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 Okay.
Thank you, Doc. I have to run. Bye-bye.
Bye-bye. Okay. Any more questions?
Yeah, I have to follow up the question from Mel Cabrera kasi para magkasunod sila. Ang
Mhm.
question niya ay, Doc, others says na huwag daw basain ang sugat para mabilis mag-heal. Anong comment po on this perception?
Para mabilis mag-heal.
Mag-heal, huwag basain.
Okay, hindi siya baka hindi ang reasoning ay hindi para hindi magka-infection. Kasi
Mel, would you like to profound on this question?
yung healing ba ang concern o yung infection?
Yung ano to, yung healing.
Healing.
Opo.
Okay. Kasi kadalasan when you say basain, ang fear ng mga lay people is baka mag-infection, di ba? Pag binabasa, no? Okay. Anyway, let me try to tackle yung myth ang tawag doon, ha? Okay. So again, I will discuss this in the operations wound in my I don't know whether it will be next week or ano, no? You can wet the wound, no? Okay. In fact, when you get bitten by a dog, when you get a scratch on the nasugatan ka, or napaso ka, okay, the first aid recommended there is wash right away, di ba? With running water. Tama? Okay. Although not all are following that, di ba? Yung iba, pag napaso, maglalagay ng Colgate, maglalagay kung ano, di ba? Tama? Okay. Yung iba naman, pag nasugatan, ay masakit, no? So, matagal bago basain, no? Okay. So, lalo na sa mga kagat ng aso, o kagat ng ano, the best is still to wash right away, di ba? Okay, right away. Para matanggal yung mga bacteria, mga germs na galing sa aso, rabies, di ba? Ganon. Okay. So that in itself prove that wetting the wound with water is not bad, no? Okay. So may advantage, no? Okay. Now, it's true that kaya tayo nagpa-pep talk, no? We have different opinions even by doctors. May mga doctors will say, bawal basain, Di ba? Lagyan mo yung dressing for the next 1 week or 3 days, gano'n. Yung iba naman, like me, I will tell you, parang kay Susan, tanggalin mo na yung gasa, no? Let it dry, wash it, di ba? Okay? So, in terms of concern, kung ginawa yun, sabihin natin infection, no? Infection muna ha, kasi yun ang takot natin, di ba? Kung basahin. So, wala, no? Okay. So, it's not true that when you wet it, you're gonna have high incidence of infection, no? Even without antibiotics, ha? Okay. So, just wash it with soap and water. The incidence of infection will not be significantly worse or higher than those na nakatakip, na nakadress na hindi binabasa. In fact, theoretically, mas pangit yung hindi binabasa. Di ba? Or, when you say hindi binabasa, hindi mo tinatanggal yung gasa. Tama? Okay? Tama? Hindi mo, okay? That's one way, di ba? Ang hindi mo tinatanggal yung gasa, na mag-iipon yung mga dumi doon sa ilalim ng gasa. Di ba? Okay. So that might cause, that can contribute to higher incidence of infection compared to a situation na pinabasa mo, nililinis mo, pinabawasan mo yung mga germs, yung mga ano. Okay? Tama? Okay. But for the yung isang connotation na may gauze ka, yung iba naman pag sa hospital ka, tinatanggal ng mga doctor yung gauze every day, then lilinisin, di ba? With a lot of antiseptics, di ba? Okay. So again, kahit na gawin yon, compared to binabasa with tubig, when you say basa is yung plain water, ha? Okay. Okay. So walang significant na high incidence of infection. Okay. So for that reason, okay, even if you read the internet, although you can see iba bawal, iba pwede, no? Pero majority will say na ano, na walang higher incidence of infection, no? Okay. Now as to the wound healing, yung wound healing will be mahirap mahirap identify yung what exactly will promote wound healing or hinder wound healing. Okay. So, of course, infection will hinder wound healing kung may infection, no? So, as I said, kung di mo tinatanggal yung dressing, di mo binabasa, hindi mo nililinis, higher incidence ng infection yon, higher incidence ng germs, no? Okay. So that might delay the healing also, no? So another possible cause of healing, which we don't usually see, yung resistance ng katawan ng tao, no? Depends, kasi may mga tao na mahina ang host resistance, kaya madaling nagkaka-infection, no? Okay? May mahina ang wound healing, no? Okay? So hindi yung dahil sa binasa, no? Okay? May mga tao talagang inherently mababa ang yung healing power ng katawan niya. Example, yung may mga diabetes, no? Okay? So mahina ang wound healing noon, no? So to summarize what I just said, pwedeng basain. Huwag kayo matakot na it will hinder wound healing. Huwag kayo matakot na magkaka-infection. Okay? Kung magkaka-infection siya, na binasa mo, hindi dahil sa binasa mo. Dahil sa, from the very start, yung at the time na nasugatan ka, andun na yung germs. No? Okay? Not because of binasa mo. Okay? Nako mo? Andun na yung germs to start with na hindi natin na-control lang. No? But very, as I said, very invasive, maraming germs, no? Na hindi natanggal lahat, no? Kaya nag-infect. Not because hindi mo yung paglinis mo everyday, baka hindi kumasya, no? Baka kulang, no? Okay? Okay. So pwedeng basain, na? Huwag kayo matakot, na? Okay. Okay? Any more?
Another question from Chris. Pag masakit po ba umihi pero wala namang fever, may UTI?
Pag masakit ba umihi?
Umihi.
Okay. As in a lot of situations, fever is a good sign. Okay? So pag may fever tayo, we usually think of infection, we think of inflammation, no? So dalawa lang yan, ha? Infection or inflammation na lang, sige. Or the other one is just reactions, the third one, no? So between the two, sabi natin infection, inflammation. Inflammation is not the same as infection, ha? May inflammation lang, yung medyo may konting reaction, but not to the point of infection. Ang basis natin for infection is yung mga, kanina sinabi natin, may invasion, merong pus, no? Okay, ganon, no? Mapula, no? Ganon, no? Pero there are instances in which you have inflammation, wala pang infection, you can have pain, but wala pang fever, no? Pwede din yun, no? Okay. So, as I said, when you hear about fever, ang reaction mo, baka, ay, may infection nito. Okay lang just ina-assume lang ninyo, pero just i-control lang natin yung pag-iisip natin. Pwede pa rin inflammation that it might go away, just baka hindi naman talagang frank infection pa, no? And then, there are a lot of diseases sa katawan, no? Na walang ina-expect mo may infection, may fever, no? Pero wala, no? Okay. Just like when we talk about ano ba yung pinag-usapan natin, yung mga making sense of flu, ano ba yung title natin, Abe? Making sense of flu and COVID and flu-like symptoms, di ba? We still remember that lecture, no? Okay. So, meron kang package ng flu-like symptoms, pero hindi ibig sabihin ay palaging may fever. Di ba? You can have flu without fever. Okay. So, ganun din dito. A lot of conditions, you can have something, pero walang fever. No? So, kahit na may UTI ka, UTI means urinary tract infection, you may not have fever. Okay? What's more reliable here is that masakit. Na, okay, may pain, sabi natin dolor, no? Okay. Kung may pus lumalabas sa ihi niya, talagang 99.9% may infection siya sa ihi, no? Kung walang pus, okay, masakit lang kasi sa ano ito, sa urinary tract. Kung may fever siya, all the more you think of the infection of the urinary tract. Pero kung walang fever, pero masakit ang pag-ihi niya, no? You still think of urinary tract infection. Okay. So that's how we process it. No? Okay. So, maganda sana kung may tatlong clues na for possible medical condition, mas mabigat yon to support that as a basis for that condition. Pero kung kulang ng isa o dalawa, okay lang. You may have to suspect UTI pa rin, no? In this particular case. No? Okay? Did I answer your question? Pag masakit ba umihi, pero wala namang fever,
May
okay.
UTI.
Okay. I will answer you, pwede walang fever na may UTI. No? Pero hindi but we have to dissect it. Bakit siya nahihirapan umihi? Diba? Kung lalaki ito, baka meron siyang prostatic hypertrophy, hindi siya UTI, no? Okay? Okay. Masakit ito, no? Masakit umihi, no? Masakit umihi, no? Okay. Masakit, when you say masakit umihi, ano yung pag-ihi, masakit o mahirap umihi? Kung may dugo, masakit din umihi yun, di ba? Kung may dugo, no? So baka Grace, would you like to amplify on that? Ano? Grace? Pag masakit ba umihi, pero wala...
She's saying, pag umihi daw may pain.
Pag umihi, may pain. Okay, the first thing that you suspect is that you suspect a urinary tract condition, no? So, ang pinaka-common is infection. So, you consider infection kahit na walang fever, no? So, yung masakit na umihi, pwede ding non-specific, no? Okay. Non-specific means wala ring UTI, pero masakit lang umihi na sandali lang, baka nagkaroon ng irritation, inflammation lang, no? So it might go away in 1 day or 2 days time, no? Ganon. So it's not really infection, no? Na-experience ko na yun dati, no?
Hi, Doc.
Na-experience ko yun
Doc, good
dati.
afternoon.
Sige, Chris, andiyan ka na. Okay.
Apa, sorry, nagano ako ng headset. Doc, pag ganyan po ba, kailangan ba namin i-observe muna o mag-urine, sinasuggest niyo po na mag-test ng urine test?
Okay, so consultation nito. Ilang taon na yung pasyente mo?
Si Inay actually.
Ha?
Ano siya, 65, Doc. Si Inay actually, kasama ko siya. 65.
Lalaki?
Kanina, parang nagsabi lang, si Inay po, babae.
Babae. Nahirapan, masakit ang pag-ihi niya. Okay.
Sabi niya lang kanina umaga, medyo masakit daw umihi. Sabi niya.
Parang masakit. Okay? Umaga. Okay. You can still observe.
Apo.
You can still observe ang worst scenario, probably ang pinaka worst scenario will be UTI, no? Pero you can ask her to observe mo na drink a lot of water kasi kung minsan yung UTI, kung UTI man siya, kung nawawala siya pag umiinom ka maraming tubig, no? Okay. So you can observe first. Kung di pa siya nawawala for 1 week, for 4 days, 3 days, 4 days, then pa-urine test mo na. Okay. Or you can take a look also at the urine, tingnan mo kung may mapula, parang may dugo, no? Kung meron na, kahit na wala pang 3 days, pa-urine test mo na. No? Okay?
Okay po, Doc. Thank you.
Okay. Ano pa, Abet?
Yeah, there is another one from, I think, Mel Cabrera ulit. Doc, normal lang po ba na sumasakit pa rin paminsan-minsan ang operated area? Close in parenthesis, modified radical mastectomy, kahit mahigit na 5 years.
Okay, paminsan-minsan, that's a key word. Paminsan-minsan, on and off, no? So, kung yung mga paminsan-minsan sakit sa katawan, non-specific yon, you just observe, no? Okay. Kung yung tuloy-tuloy ang sakit at naging malala, may problema yon. Okay? That's one clue. Okay? And then, so this is not a sign, wala namang sign of infection. No? Okay? Walang pus, walang nana, walang swelling, di ba? Sakit lang, di ba? Okay? Walang mapula, no? Okay. At if you are inferring baka merong problema dun sa operation, baka nagkaroon ng infection, hindi. Kasi 5 years na, no? Okay. Yung infection usually within 1 week, pero usually kami inihintay pa namin 1 month after the operation just to make sure na walang infection, no? Kaya usually ang check-up namin for all patients, usually 1 month. After 1 month, we can tell them confidently wala nang problema in terms of infection and other complications, no? Okay. But as I said, usually kung may infection, usually within the week, no? Okay. Within the week, mas common, no? Okay. So, yung paminsan-minsan sakit mo, basta walang bukol, wala kang nakakapang bukol, walang recurrence, no? Okay. Ano lang yon? I just call it non-specific, hindi natin ma-identify exact cause, but it's not something serious, no? Okay. At kung minsan, I don't know kung tama ako kasi mahirap to look for a explanation that will be maintindihan ng pasyente. Sasabihin ko, ay baka ano yan, yung, kasi may operasyon, na-irritate lang yung nerve, yung mga ugat, yung nerve, no? Okay. So, pero mawawala rin yun, no? Okay. I-observe mo na lang.
There is a follow-up question from Chris Nesea. To add po kay Mel, pag maulan, makirot, Pag malamig po, bakit kaya po?
Yan nga. Yan ang sagot ko doon. Non-specific, we cannot really identify. When say non-specific, we cannot specify, no? Non-specific, no? But it's something not serious, no? Okay. It will be, kumisan, it will be there, pero hindi siya on regular timing, no? Pabukso-bukso lang, di ba? Okay. So, it may be, that's why I said, pag ito yung mga sinasabi sa mga pasyente, pag naulanan, makirot, kung malamig, may change of temperature, gano'n, no? So sabi ko, baka na-irritate lang yung ugat ng nerve, no? Okay. That's my usual explanation, no? Okay. Okay. Pero come to think of it, kahit na walang operasyon, nagkakaroon kayo ng sakit-sakit sa buong katawan, di ba? Ibang parting katawan, na sandali lang at nawawala. No? Tama?
Yeah. Doctor, I have a question. What about, two questions. What about sepsis? And number 2, is bacterial infection can be considered also as viral infection?
No. Bacteria is bacteria. Viral is viral. Iba yun. No? Okay. So yung germ ng bacterial infection is a bacteria. Yung germs dun sa viral infection, virus. No? Parang yung COVID-19, it's a virus. It's not a bacterial infection. No? So yung leptospirosis, last time we talked about leptospirosis, di ba? It's a bacterial infection. No? Okay. Very clear. No? Okay. Ano pa ba yung pagka fungal infection, alam natin, no? Fungal, no? Pero, but if you have pneumonia, first, pneumonia is infection of the lungs, no? Okay. So, pwedeng bacteria, pwedeng virus. Okay. So, the doctor will have to identify which one, di ba? But more commonly, bacteria pa rin, no? Okay. Pero kung hindi siya na-identify na talagang which one, no? So the doctor will not be able to say definitely whether it's virus or bacteria. But most of the time, ina-assume na nila na bacterial infection na, no? And then yung sa URTI, yung mga cough, colds, throat infection, no? Ina-assume pwedeng bacteria, pwedeng virus, no? Pero mas common yung virus. Kaya we just say that most likely it's a viral infection. Kaya yung mga flu is caused by virus, di ba? Not bacteria. Okay? Ano yung unang tanong mo? Yung sepsis?
Sepsis, yeah, the sepsis.
Sepsis is a worse stage of infection, no? Yung kanina sinabi ko, yung entry point, yung pumunta na sa dugo, no? Punta na sa dugo, kumakalat na sa buong katawan, no? So the bacteria has reached the bloodstream, no? And then nagkakos, we call that septicemia, no? Sepsis, septicemia, no? Okay, mas malala yun, no? Buong katawan na affected, no? Okay. So most of the time it's caused by bacteria, but there are some such thing as viral septicemia also, no? Mas hindi siya common, no? Okay. Any more?
Doc,
Yeah.
what is hydrocortisone? Because I hear it from some people na they put hydrocortisone for
Steroids.
cleaning.
Steroids.
Steroid. Oo.
Saan mo narinig anong context ng narinig mo?
Hindi, may kakilala kasi ako, yung wound niya nilinisan ng hydrocortisone. Tama ba 'yon?
O ini-inject?
Hindi, parang nilinisan lang ng hydrocortisone ba 'yon? Ay, baka mali naman yung pagkakarinig
Hindi,
ko.
pwede. Baka number one, you talk about the wounds, di ba?
Yeah.
Wounds, hindi bagong operasyon. Matagal na.
Hindi naman, oo.
Okay, baka
Matagal-tagal.
baka yung context noon, baka gusto nila the premise that they want to avoid yung mga keloid formation.
I see. Oh,
Okay, so some would apply yung mga steroids, no? Okay, to
di ba
avoid
delikado yun? Oh,
lahat lahat naman may ano,
Yeah.
may side effects, no? Okay. So I'm just answering your question, di ba? Yung pag sinabi mong
yeah. Oh,
hydrocorticosteroids and then wound, most likely they heard it over the radio or over the internet, or their doctors who are trying to promote their products, no? Okay. So they ask them to apply, no? To apply the medicine, no? Okay. So yun yun, no?
earlier, sorry.
Most likely
Earlier,
for keloid.
uh,
Most likely for
earlier,
keloid.
last, you were telling us earlier to clean with soap and water. Yung like ako, I can clean already within 2 weeks na kasi soap and water lang, no? Very basic. What kind of water? Is it lukewarm water or tap water?
Tap water will do. Tap water will
Okay.
do, no? Kasi I don't think yung tap water
Lukewarm.
natin is actually madumi, di ba? May konti, may ano yan, may konting, hindi naman frankly madumi, no? Okay. So, kumisan tayo, nakakainom din tayo ng tap water kahit na ayaw natin, di ba? Nililinis natin yung mga plato natin with tap water, with baso, di ba? So, naiinom pa rin natin, no? Although nowadays, we try to drink only yung mga bottled water, the mga distilled water, no? Ganon, no?
Yes.
So, unless frankly infected, contaminated by bacteria, then you don't use the tap water, no? So, kung ayaw mong, kasi minsan meron kang mindset na kasi palagi tayo umiinom ng bottled water na yan kasi baka marumi yung tap water, you can use the bottled water, no?
Okay.
Okay.
Oo.
Okay.
No.
Usually ang pinaka-ideal doon yung tinatawag na normal saline solution, no? Yung may salt, no? Yan ang pinakamaganda, no? Pero mahirap imimix mo pa ng tubig tsaka asin, or meron namang commercial preparation, bibili ka pa, di ba? Normal saline, no? So tap water na lang will do, no? Okay. Now whether it's lukewarm, ano ba, cold or hot, no? Lukewarm will do. Lukewarm will do, no?
Okay.
Okay.
Okay. Thank you.
Lukewarm will do. Okay. So all of us, sino ba yun? Those who I have operated on Ellen, I have operated on Phoebe, Mel, Jane,
Ako.
Orly, Susan, Mary Ann. Okay. Those were years ago. Ganun pa rin advice ko, di ba? Water, just wash with soap and water. Tama? Can you validate that?
Yes, Doc.
Okay. So,
Yes.
tama? O, ano nangyari? Nag-heal, di ba? Walang problema, di ba?
Opo.
Yes.
Okay. So, Susan, yan ang validation sa mga old-timers ko.
Lalo na ako, 2 weeks pa lang ako.
Okay. Even si Mary Lynn, di ba? Okay. Tap water lang, di ba? Water lang, di ba? And then I don't advise you to use betadine, di ba? Which is commonly practiced. Okay? So hindi kailangan, no? Okay. Kasi kung yung mga in-advise ko water lang, nag-infect, baka may question na yun. Eh, gumaling naman, di ba? So without betadine, di ba? Okay. Now, in the internet, you're going to see may mga debate na rin yan, no? Some would say na huwag kayo gagamit ng betadine, no? O dati gumagamit sila ng hydrogen peroxide, di ba? May hydrogen peroxide pa yan, natatandaan niyo, no? Before the popularity of the betadine, may hydrogen peroxide pa, no? Panlinis, no? So yung hydrogen peroxide sa yung mga betadine, sinasabi nila it can hinder wound healing. No? Hindi lang na. Kasi, kasi chemical siya eh. May pinapatay siya ng mga cells. No? Okay. Okay, may pinapatay siyang cells. No? Kaya it says that don't use hydrogen peroxide, then don't use betadine anymore because it will impede or hinder wound healing kasi pinapatay niya yung mga cells na hindi yung gumagaling ng gano'n. Na of course, yung company ng betadine, of course, will always say na, sige, maganda yung betadine, maganda yung betadine. Na, so mga marketing yan, wala tayong mahirap kalabanin. Na, okay. So, but just take it from the experience of others na wala naman nangyari, di ba? Okay. So, sa bahay ko, tinapon ko na lahat ng betadine ko, inubos ko na, hindi na ako gumagamit ng betadine sa bahay. Soap and water lang.
Doctor, there is a validation also from Mel Cabrera. He said, I was amazed when I undergone modified radical mastectomy. The wound was big, but it was not painful. Deepest thank you to you, Doc. More power and God bless you always po.
Okay.
Tapos si Chris, hi everyone, sharing po nakabay na po ako ng shoe cover. So, I hope everybody can see it. Yung shoe cover natin for the last topic that we had last Saturday.
Leptospirosis, yeah, we had.
Ayan,
Okay.
yung shoe cover.
Okay. Thank you, Mel, for that feedback. No? So, para ma-enlighten din ating mga kasama rito, especially the newer ones. No? Okay. And as I said, yung mga talks ko is based on my personal experience. No? Okay. Okay, Mary Ann, meron ka ng input, Mary Ann? Doon sa shoe cover?
Nakita ko eh. 110 po.
110?
Taas.
Okay. Anyway, bahala na I'm not out to what do you call, to recommend one particular product na. Okay. Pero nasa inyo which one you want to buy, which one is not. No? Ito yung increase is 68 per pair. So, kung meron I think kung kasi less than 100, bilhin na lang ninyo kahit na ano. Kung anong gusto ninyo, just keep it muna. Kung masira, then palitan na lang ninyo. Medyo mura-mura lang naman eh. No? Parang reserve lang. No? Okay. Okay? So, sino nakabili na except for Chris? Baka next week umulan na naman, bumaha na naman. Sana hindi. Okay. Okay. So, if there are no more questions, it's 3:15. Okay. Last call for any questions kung meron kayo.
Late na Doc. Lampas na tayo 3:20 na.
Can I ask?
Sure. Sino? Mary Lynn?
Yeah, can I? Kahit na
Sure.
lampas na time.
Yeah. No problem. What's your question?
I messaged you regarding cellulitis. Kasi my mom had yung ganun, almost all the symptoms that you gave. May warmth, hindi fever nga lang. She has pain, there is redness, there is swelling. Pero hindi siya feverish. No pus pala. Pero may warm yung area. And it's been quite some time. And her cardio said she has cellulitis. Pero
Cellulitis
sabi
na po.
naman, hindi.
Saan anong nasaan yung
Sa outer part ng both legs.
outer part of both legs? Okay. Paano nagsimula?
Basta mapula lang muna and then medyo namamaga. Tapos masakit hawakan.
Ilang taon na siya?
Yung
Ilang taon na?
pamumula, Doc?
Hindi. How old?
She's 96.
Ha?
96 years old.
96. 96 and then palaging nakahiga?
Hindi naman.
Up and
Seated
about?
most of the time.
Up and about?
Seated and then
Seated?
not really, pero kasi she finds it difficult to walk.
Okay, difficult to walk. So sa likod, outer part of the thigh, of the legs.
Wala naman sa thighs, sa legs lang.
Sa legs.
Sa legs lang.
Okay, sa legs, dalawa. Namamaga.
Yes.
Namamaga.
Yeah, medyo maga. And then, pag nahahawakan, masakit daw.
Okay. And then,
Apula.
namamaga, masakit, walang fever. Okay. So, pwedeng, pwedeng cellulite. Kailan ba? Recently? Recently?
Medyo more than a month na Doc.
Kung more than a month na, baka. Pwedeng chronic cellulitis, pwedeng lymph edema, no? Namamaga ka mo, di ba? Kabilaan, medyo masakit.
Yes.
Okay. Pwedeng lymph edema because of yung blood supply niya, yung vein na yung although it's not hindi pa siya to the point of varicose veins, pero yung blood supply niya, yung paakyat papuntang puso, no? Is not properly functioning na kaya nagpo-pull sa baba, no? So kung masakit na masakit, you have to consider baka phlebitis pa, no? Okay? Yung mga infection ng blood vessels, no? Okay. Thrombophlebitis, no? Okay.
But she was scanned, Doc. Na venous and arterial scan siya, wala naman siyang phlebitis.
Wala. Very good. Very good. So nagawa na pala. So nawala. So baka ano lang 'yon. 1 month na.
And then the cardio suggested go ask a derma, and the derma said hindi yan cellulitis, ano yan? Senile purpura.
Senile purpura.
Yes.
Very good. Hindi man nakakamatay yan. Senile purpura.
Pero kasi initially, the cardio said, apply kayo ng Bactrim. The derma naman said, don't. Apply Hirudoid lang. So we don't know ano yung dapat na talaga.
Thank you for sharing. It shows that maraming opinion mga doktor iba-iba, no? So, okay. Pakita mo na lang sa akin ng picture. Can you take a picture? No? I will add my third opinion. No? Okay. So you have a cardio, you have a derma. Okay. Baka
later na lang, Doc, when I see you during the week. Kasi right now, malayo ako. I cannot take it.
Hindi. Ask somebody, your relatives, to take a picture of the legs. You don't have to go there. No? So, kaya nga maganda itong telemedical, di ba? Take a picture. A lot of times I can make a diagnosis based on the picture plus the data. Kung 1 month na, most likely hindi siya cellulitis na, hindi siya acute cellulitis. At sabi ko nga, possible thrombophlebitis which was entertained by the doctor, kaya pina-Doppler scan nila, di ba? Okay. So negative naman, no? So I would probably, when I take a look, most likely I might agree with the derma, no? Senile purpura, no? In which you don't actually have to do, pero you may have to do something because of the pain, no? Pero yung mga purpura na yon, usually walang ginagawa na doon, no? Okay. Okay. So take a picture na lang, then send it to me, then I can help you make a diagnosis, no? Okay?
Surely do you have?
Okay.
Surely you try to send it. You want it now, Doc? Later na lang, Doc, or
Yeah, no problem, no hurry. Kayo you can always reach me anytime. You just send it to Viber, no? Okay.
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 Sige. Thank you.
Thank you. Okay, we'll call it a day. It's 3:30. So we will see each other next week again. Thank you for attending. No? Okay. Wala na, Abet?
No more.
Okay, bye-bye. See you.
Salamat. Thank you po.
Thank you po.
You're welcome.